Good day, I'm Dr. Maryna Zhuravlova. I'm from Soviet Union. In closed country, we have basically nothing, so everything we need we used to do by our hands. We keep this ability through our lives. So today I will tell you one of tale from our clinic. I have a patient with disseminated symmetric pigmentation on her body. She have a long journey through the doctors. They give her a lot of whitening agents like hydroquinone, arbutin, kojic acid. They make microdermabrasions, peelings, and a lot of sessions, but nothing helped to her. When I asked her to bring the prescription lists, none of them contain diagnosis. So first of all, what I want to tell, don't treat your patient until you obtain correct diagnosis, because not all pigmentation can be simply erased. The diagnosis was made clinically. It is disseminated macular amyloidosis. Told the patient that it will be very hard to get rid of it. For medical legal purposes and for teaching purposes, we take biopsy. We ordered H&E, pus, and Congo red stain. What is nice about Congo red stains is can bring apple green birefringence under polarized light, which is characteristics for amyloid. The problem is we don't have polarized light microscope. What to do in this case? Generally, our microscope is Ziess. He is very nice, but we can order for it polarizing filter. It will take a lot of money, a lot of time to wait. The Gumruk will take charges and everything like this. So no, we will try to do everything as we used to for free and fast. Let's see the polarizing microscope operating principle. It has two polarizing filters. One of them should be placed above the light source. Another one should be placed above the sample. You are moving one of them clockwise or another direction. It's not a big deal. So you are moving it circularly until you see the darkening of the field and birefringence, which is mean double refraction. It is the optical property of a material having a refractive index that depends on the polarization and propagation direction of the light. All this is nice. We have the best possible education in Soviet Union, but okay, just forget. We need two polarizing filters. Where we can get them? First, it is developed X-ray film, but you need really very old X-ray film because now they are just printing them and they don't have polarizing film on it. Okay, it can be old calculator LCD screen. It can be sunglasses with the polarizing film on it, or any old mobile laptop screen or digital camera CPL filter. You remember, you take any old mobile, be sure that this is the LCD screen, not TFT, not OLED, not AMOLED. It should be LCD. And remember your forensic medicine course or pathology course and try to make autopsy. Be sure before autopsy that the patient is really dead. What you will need is just the screen. You take the screen from this device, all the rest you can put to the garbage bin. And you see when you will take the screen off, you see it under the microscope. This futuristic red, green, blue pictures. It is how the true LCD screen look under the microscope. If you have this picture, so you are on the right track. Place one above the source of light as you see in this picture and another one just above your sample. So you will